Hello everyone, we are from Group 1 INC. In this opportunity, we're going to present the chemotherapy agent Vincristine. These are the overviews. These are our group members. So first, we're going to talk about the definition of Vincristine. So Vincristine is chemotherapy medication drugs that are used to treat various types of cancer, including leukemia, lymphoma, neuroblastoma, and also Wilms tumor. Second, we're going to discuss about the generic and trade names. The generic names are vincristine sulfate or leurocristine. The trade names are Vincasar PFS, Vincrax, Chiocristine, Uncommon, Vincasar, and also Marquibo. This is the picture of dosage form. They come in the form of two dosage. There are the 2 milligrams and also the 1 milligram.
Okay, so next I'm going to talk about the indication of vincristine. Vincristine formerly indicated for first, Wilms tumor. Wilms tumor is a rare kidney cancer that primarily affects children. Second, neuroblastoma. Neuroblastoma is a cancer that develops from immature nerve cells, mostly found in infants and young children. Third one is rhabdomyosarcoma, which is a cancer that forms in soft tissues such as muscle and is most common in children. Next one is certain brain tumors. That is a various types of cancerous growths in the brain, affecting brain function and also health. Next, acute lymphocytic leukemia, which is a type of cancer where the bone marrow makes too many immature lymphocytes or a type of white blood cells. Next one is Hodgkin's lymphoma. It's a type of lymphoma which is a blood cancer that starts in the lymphatic system characterized by the presence of red stem cells. And the last one is not Hodgkin's lymphoma. It's a group of blood cancer that includes all types of lymphoma, except Hodgkin's lymphoma, involving abnormal lymphocytes. Next is the contraindication. Vincristine should not be used in patients with demyelinating forms of Charcot-Marie-Tooth syndrome. Vincristine should not be used in patients with this inherited nerve disorder because it can worsen nerve damage. Second, existing severe neuropathies, as it can exacerbate their condition. Third, hypersensitivity to vincristine or any component of the formulation. Patients allergic to vincristine or any of its ingredients should not use it to prevent severe allergic reaction. For hepatic impairment, caution is advised for patients with liver problems because vincristine is metabolized in the liver, potentially leading to increased toxicity. And then also, vincristine should never be injected into the spinal canal as it can cause fatal nerve damage. Okay, so based on the drug classification, is vincristine classified as a controlled drug or uncontrolled drugs? Vincristine is classified as a controlled drugs. Controlled drugs are substances regulated by the government laws due to their potential for abuse, dependence, or harm. Vincristine is specifically regulated because it is a potent chemotherapeutic agent, and its use must be carefully managed to ensure patient safety and efficacy, and also to prevent misuse. Second is vincristine classified into the family therapeutic or physiologic category. Vincristine is classified into the therapeutic category. Therapeutic classification focuses on the use of the drug to treat certain conditions or diseases. Vincristine is utilized for its therapeutic effects in treating various cancers. Okay, so as you can see, this is a drug classification diagram. You can see also that the vincristine is pointed by the red arrow. So first of all, vincristine are classified in this big group called chemotherapy agent because it is used in chemotherapy to treat cancers. And then it moves to the smaller class or smaller group called antineoplastic, and then from there it classified into a smaller group called mitosis inhibitor, which means that vincristine inhibits mitosis or cell division, thus preventing cancer cells from multiplying and spreading. So from this classification highlights that Vincristine's role in cancer treatment, especially in its mechanism of action in disrupting self-division, which is crucial in controlling and reducing the growth of tumors.
Vincristine is always given intravenously over 5 to 10 minutes. The drug vincristine is not recommended for emergency administration. Several fatal cases have occurred due to the route of administration. The following is the dose according to their age. Adults, the drug is administered intravenously at weekly intervals. The recommended dose is 1.4 to 1.5 milligrams per meter square up to a maximum weekly dose of 2 milligrams. Children, the suggested dose is 1.4 to 2 milligrams per meter square given on a weekly basis with a maximum weekly dose of 2 milligrams. For children weighing 10 kg or less, the starting dose should be 0.05 mg per kilogram administered as a weekly intravenous injection. Elderly, the normal adult dose is still appropriate at this elderly. Hepatic impairment. Because of the hepatic metabolism and biliary excretion of vincristine sulfate, reduced doses are recommended in patients with obstructive jaundice or other hepatic impairment. Patients with liver disease sufficient to decrease biliary excretion may experience an increase in the severity of side effects. A 50% reduction in the dose of vincristine sulfate is recommended for patients having a direct serum bilirubin above 3 mg per 100 ml or 51 micromole per liter. Methods of administration precautions to be taken before handling or administering the medical product. This preparation is for intravenous or IV use only. It should only be administered by individuals experienced in vincristine administration. Considerations for vincristine include 1. Symptoms management. Dressing interventions focus on managing symptoms such as nausea, vomiting, constipation, and neurotoxicity. 2. Patients education. Educate patients and families about the potential and symptoms of neurotoxicity, emphasizing safety precautions. 3. Monitoring. Regularly monitor patients for signs of neurotoxicity and adjust dosage accordingly. 4. Dose adjustment. Reduce the dose or discontinue the drugs if severe toxicity occurs. 5. Coordinations of care. Coordinate care with primary care providers such as nurses, pharmacists, and oncologists to enhance awareness of monitoring parameters and potential adverse events. 6. Prevention of medications error. Implement measures to prevent medications error such as proper labeling and administration. 7. Supportive care. Provide supportive care including hydration and laxative to manage side effects. 8. Patient safety. Ensure patient safety by monitoring for signs of extravasation and administering the remaining dose via a distinct vein if necessary. 9. Dose adjustment. In special populations, adjust dosage based on hepatic impairment, renal impairment, and pregnancy consideration. 10. Long-term monitoring. Monitor patients for long-term effects and adjust treatment as needed.
Okay, so next is about the side effects of vincristine. First is risk of infection. Second, bruising and bleeding. Third, anemia. Fourth, constipation. Fifth, diarrhea. Sixth, numb or tingling hands or feet, which is related to peripheral neuropathy. And there are also other side effects like sore mouth or throat, skin changes, hair loss, liver effects, headaches, blood pressure changes, jaw muscle or joint pain, eye problems, hearing changes, nervous system effects, and the last one is tumor lysis syndrome or TLS. You can read the description on the slide.
Mechanism of action or pharmacodynamic. Vincristine primarily disrupts the microtubule dynamics, which are crucial during the cell division, especially in the M and S phase. It binds to the plus ends of microtubules, preventing their elongation by stopping the addition of new tubulin subunits. This interference disrupts the formation and the functionality of the mitotic spindle, a structure necessary for chromosome segregation during mitosis. And as a result, cells treated with vincristine arrest in the metaphase stage of the cell cycles because they can properly align and also segregate chromosomes. And prolonged metaphase arrest triggers the apoptosis, or programmed death cells. This is particularly effective against rapidly dividing cells, such as cancer cells, while sparing most normal cells. Now let's move to the pharmacokinetics of vincristine. It's administered intravenously and is quickly absorbed, reaching peak plasma concentration within minutes. Vincristine has a large volume of distribution and binds extensively to plasma proteins and blood cells, especially platelets. It accumulates in various tissues but has limited penetration through the blood-brain barrier. And in the liver, vincristine undergoes extensive metabolism primarily via CYP3A4 and also CYP3A5 enzymes. Its main metabolite for disacetyl vincristine has some anti-tumor activity but is less potent than the parent drug. The drug is mainly eliminated through bile and feces, with only about 20% excreted unchanged in the urine. Its eliminations follows a biphasic pattern with an initial rapid phase and a longer terminal phase. The elimination half-life of vincristine ranges from 10 to 155 hours depending on the individual factors such as age, liver function, and concurrent medication. Understanding these pharmacokinetics properties is crucial for optimizing vincristine's dosage and administration to ensure the effective of cancer treatment.
So, vincristine is a chemotherapy medication used to treat various types of cancer. Its safety during pregnancy is classified under different categories depending on the country-specific regulatory body. 1. FDA Pregnancy Category D. There is positive evidence of human fatal risk based on adverse reaction data from the investigational or marketing experience or studies in humans, with potential benefits may warrant use of the drugs in pregnant women despite potential risk. 2. AUTGA Pregnancy Category D. Drugs that have caused, are suspected to have caused, or may be expected to cause an increased incidence of human fetal malformations or irreversible damage. These drugs may also have adverse pharmacological effects. Vincristine should generally be avoided during pregnancy, particularly in the first trimester, unless the potential benefits justify the potential risk to the fetus. Pregnant women who need vincristine should be closely monitored, and alternatively, treatment should be considered when possible. And a special precaution. 1. Neurotoxicity. Vincristine can cause significant neurotoxic effects, including peripheral neuropathy, cranial nerve neuropathy, and automatic neuropathy. Patients should be monitored for signs of neuropathy and dose adjustment may be necessary. 2. Extravasation. Vincristine is a vesicant, which means it can cause severe tissue damage if it leaks out of the vein during administration. Careful administration techniques and immediate intervention if extravasation occurs are critical. 3. Hepatic impairment. Vincristine is metabolized by the liver. Patients with hepatic impairment may require dose adjustment and should be monitored closely for toxicity. 4. Fatal risk. As previously mentioned, vincristine can cause fatal harm when administered to a pregnant woman. Women of childbearing potential should use effective contraception during treatment. 5. Gastrointestinal effects. Severe constipation and paralytic illness are potential side effects. Preventive measures and prompt treatments of these conditions are necessary. 6. Drugs interaction. Vincristine can interact with other medications such as CYP3A inhibitors, which may increase the risk of toxicity. Careful review of the patient's medication list is essential.
These are the references and sources we use in making the video.
So that's all from group 1. Thank you.